California just became the first state to order all healthcare workers have COVID-19 vaccinations. And this move comes as the state's health department says California is, quote, currently experiencing the fastest increase in COVID-19 cases during the entire pandemic.
Wow. All right. Joining us once again is the state's Secretary of Health and Human Services, Dr. Mark Ghaly. Thank you so much for being with us. And this is an alarming fact. According to the Seattle Times, around 19% of California's recent COVID cases are actually vaccine breakthrough cases. What do you make of that number? What is the significance of that number?
Well, we know that people who've been vaccinated still can be infected by COVID. The really good news is some of the horrible outcomes, hospitalizations, ICU, even death, we're well protected. And so we know that people can still get infected, especially with Delta, that's that much more transmissible, that much more infectious. But we are really encouraged by the fact that even those, quote, breakthrough cases aren't leading to the kind of consequences we were worried about in the winter and all of last year.
And Dr. Ghaly, we have school coming up. Oftentimes, places all over the country look to California. You'll have more public school students than anybody, 6 million plus. Going back to school, they're going to wear masks, they're going to social distance. But beyond doing the things that those mitigation measures that have been in place through the pandemic, is there anything extra that you plan to be doing to try to possibly slow down this Delta variant?
Well, I mean, most importantly, I'm glad you mentioned the masking because, yes, California students are going back masked up. We took the CDC's recommendation and made it a requirement across our state for exactly this reason. We saw the increased numbers with Delta coming. We knew we could get kids back safely by using these tools. But the most important thing people can do is get vaccinated. Those around students, those who are eligible, age eligible, who are students, getting vaccinated is going to be the key. And as Dr. Ashton mentioned, really encouraging us to get EUA approval for the youngest students, those 5 to 11, to get vaccinated as soon as possible as well. As a pediatrician, that's a key fact and point.
Well, and you are mandating that your state's roughly 2.2 million healthcare workers be fully vaccinated by the end of September. What do you hope you will achieve by doing this? And tell us why it's so important for your state to do this now.
Well, the two reasons. First, people who go into healthcare are going there to take care of their health, to protect their health. We need to assure our public that they're going into an environment where people have taken the steps necessary to protect around transmission of COVID. Secondly, we know that our workforce, our healthcare workforce, is one of our most precious resources in California, and protecting them so they can take care of us when we're sick is another key point. So between those two things, we made that decision to have that requirement go into healthcare setting.
Dr. Ghaly, we want to get your take also on what we're seeing out of San Francisco, the Department of Health there. They call it a supplemental, but they said they would go ahead and allow people who had the J&J vaccine, who asked for a quote-unquote booster or supplemental shot of the Pfizer or Moderna shots, to get that supplemental shot. This goes against what the CDC is recommending, FDA is recommending. What is your standpoint on what they're doing there at the San Francisco Department of Health? Are you okay with that from a scientific standpoint and also just from a messaging standpoint?
Yeah, I mean, we're working with counties across the state, asking the question around boosters, asking when and if that should be occurring. We're taking the lead from the FDA and the CDC. So right now we're not encouraging counties, San Francisco or otherwise, to be adding that additional shot, but we're watching it closely. We know that there's concern about waning immunity, and for certain populations, especially our oldest Californians, whether another shot will be necessary. But at the moment, we're not encouraging it. We're asking people to hold off until we get clearer instructions, get a closer look at the science and the evidence before we have another shot advised. And we know this is a global condition. Getting as many people around the globe vaccinated is going to be an important way to curb transmission, not just around the world, but here in California as well.
Well, California Secretary of Health and Human Services, we certainly appreciate your time. Dr. Mark Ghaly, feel free to come back anytime. We love having you on the program. Thank you, and we wish you the best.
Yeah, thank you.
Well, hey.
Hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.